Thank you, Presiding Officer. To ask the First Minister whether the Scottish Government has made any assessment of the effect that long A&E waiting times has on patient mortality.
First Minister.
Well, I think everyone accepts that there is a link between long waits and increased risk of harm. That is why we remain committed to delivering improved A&E performance. In 2018 in NHS England, the Emergency Medicine Getting It Right First Time programme carried out an analysis of the relationship between time spent in emergency departments and patient harm. That analysis proved association but not causation. We considered that analysis very closely, and we will continue to monitor research and analysis into the relationship between time spent in emergency departments and patient harm. But of course we remain focused on ensuring we reduce waits in accident and emergency.
Craig Hoy.
First Minister, new figures have revealed that an estimated 765 people died due to dangerously long A&E waiting times last year. That means 64 patients dying needlessly, leaving behind 64 grieving families each and every month under this SNP government. The First Minister has less than 2 weeks left in the job, so she has no need to deflect, dissemble or distract attention by shifting the blame. So will she now, therefore, take this opportunity to apologise to the families of those patients who died and say sorry for her government's appalling legacy on the Scottish NHS?
First Minister.
Well, firstly, we accept, and everybody should accept, that long waits lead to poorer outcomes. That is why we focus on reducing A&E waiting times, and it's why we have worked so hard to ensure that we continue to have the best performing accident and emergency waiting time departments anywhere in the UK. Let's put some context on this. Of course, the Royal College of Emergency Medicine has made estimates about Scotland, but it is also estimated that in 2022 there were over 23,000 excess deaths in A&E linked to long waits in England. That's proportionately 3 times higher than the estimate for Scotland.
Sorry, excuse me, members. First Minister,
but
sorry, can I ask that members do not continue to contribute while people are asking questions or responding to them? Thank you.
That is why it is vital that we continue to reduce waits and long waits in particular in A&E. And in recent weeks, not only have we been seeing an improvement in accident and emergency waiting times, but we've seen a reduction in the longest waits, those waiting over 8 hours and 12 hours. And we will remain focused on securing these improvements.
Paul O'Kane.
Thank you, Presiding Officer. These are people who have died that we are talking about. In the final quarter of 2022, excess deaths in Scotland rose by almost 10% above the 5-year average, meaning that an additional 1,433 people died than would have been expected based on historical trends. Each death a tragedy, but they're not a statistical coincidence. They are evidence of widening health inequalities, the normalisation of 12 hours waiting in A&E, and a failure to increase cancer diagnosis rates. This is the heartbreaking reality of Humza Yousaf's disastrous record as Health Secretary, and it will be the legacy of this First Minister. So I'd ask her, why has she allowed the NHS to decline into such a state of perpetual crisis? And does she agree with clinicians, staff, patients and indeed her Finance Secretary Kate Forbes that Humza Yousaf shouldn't be anywhere near running our health service?
First Minister.
Every one of these numbers is a human being, and it's important that it is treated in that way, which is why when the member goes on to politicise in the way he has done, I think he kind of undermines his own argument in that. The comparisons are important only because if we listen to questions like that, the suggestion is that the situation in our National Health Service in Scotland is somehow unique and that it is all down to whoever the Health Secretary is or the fact that we have an SNP government. The reason I make these comparisons is for context. Health services everywhere are dealing with these challenges. The biggest challenge, of course, in recent years being a global pandemic that has caused many of these pressures. But that is why it is so important that we are a government that has supported and continues to support record investment, record numbers of people working in our National Health Service. We're now seeing improvements in waiting times. We want to see these improvements go further and faster, but we've seen a reduction in those waiting for the longest periods of time in accident and emergency departments. So this is the hard work of government, and this government, under new leadership in coming weeks, albeit, but this government will remain focused on doing the hard work and repaying the trust that the people of Scotland have placed in us.